Can one democratic socialist mayor truly turn a global financial capital into a political battleground in just 12 days? Welcome to the deep dive. Today is January 12th, 2026, and that marks what, just under 2 weeks since Zohran Mamdani took office as the new mayor of New York City.
It's an incredible pace. He's the city's first Muslim and Asian American mayor and the youngest since 1892.
And we are already seeing this full-scale collision of hard-left ideology with the practical, legal, fiscal realities of running a city.
Well, that's our mission today, right? To really analyze the sheer velocity of this shift. As we speak, there's a massive strike.
15,000 nurses.
15,000.
Yeah.
Across 3 huge private hospital systems, Montefiore, Mount Sinai, and New York-Presbyterian. It's happening right now.
And it serves as the perfect lens, really, to examine Mamdani's radical agenda.
Exactly. How his pro-union far-left philosophy is just clashing directly with the traditional legal understanding of governance of essential services and, the free market itself.
And we have to set the table here with the context of his election. I mean, critics on the right basically predicted this exact moment.
They did. They warned that a Mamdani administration would mean collapse, dependency, and political repression.
I remember those comparisons to socialist states like Venezuela or Cuba.
Right. And today we're going to unpack the raw data behind those predictions. We'll look at his economic policies and his actions today to see how they might be validating those worst-case fears.
Okay, so to understand just how serious this strike is and why Mamdani jumping on the picket line is so consequential, where do we start?
We have to start with the legal theory. Okay, let's unpack this. There's a really sharp legal divide when we talk about strikes.
A divide between, the private sector versus the public sector.
Exactly. Private versus public, or in this case, essential services.
That distinction feels key. I mean, when employees strike against a private company, say a factory, we see that as a legitimate economic tool.
Right. It's constrained by market reality. If the union demands too much, the company might go bankrupt or raise its prices or move somewhere else. There's a natural break on the whole thing.
But that break doesn't exist here.
Well, the legal framework shifts dramatically. The traditional legal analysis views the government not just as an employer, but as the lawgiver for the entire society. This is called the sovereignty doctrine.
So if the government is the sovereign authority, what does striking against it even imply?
It implies a challenge to the state itself. Government employees, historically, are seen as agents of the sovereign. So if they withhold essential services, police, fire, or, in many interpretations, healthcare, it's not just a labor dispute.
It's seen as something else.
It's characterized as denying the state's authority to protect its citizens. I mean, traditional legal views have called this kind of action rebellion that threatens the entire political order. It stops being about economics and becomes a political confrontation.
That makes a lot of sense. It explains why, the police can't just go on strike, but this feels a little different with private hospital nurses, even if their job is essential.
Well, that brings us to the second major legal concern that critics raise. It's called the democratic process argument.
And this is where we connect the theory to what Mamdani's doing right now.
Precisely. The argument is that these kinds of strikes distort the normal political process.
How so? Because the costs aren't really economic there.
They're political, primarily political.
Okay, wait, I'm curious about that. Couldn't you argue that voters elected a democratic socialist who ran on a pro-union platform and now he's supporting a union? Isn't that just democracy at work? Where's the line?
That's the heart of the debate. In a private company, a union bargains over profit. If the demand is too high, the company loses money, and eventually the union loses jobs. But in a subsidized essential service like healthcare, there's no close substitute for a hospital.
Right. You can't just go to another hospital chain down the street if they're all on strike.
And there's no immediate threat of bankruptcy, because the system is backed by massive public funding, insurance rates, and ultimately, our taxes.
So the union holds all the cards.
They acquire what's called a disproportionate share of effective power. The moment those services shut down, the government's political cost, public fear, outcry, actual patient harm, it just skyrockets.
And that forces the government's hand.
It forces them to make fundamentally political decisions, like satisfying extreme salary demands by redistributing income, maybe shifting funds that were meant for schools or sanitation, all through coercion, not through legislative debate.
Wow. Okay, so If that argument is right, that political coercion is the engine here, then Mamdani's whole economic plan is basically the fuel for that engine.
It is.
And this is where it gets really interesting, because his campaign promises were designed to fundamentally destabilize the existing free market consensus in New York.
And these weren't vague promises, a better future. They were specific, quantifiable threats to the established financial order. His biggest one is raising the local minimum wage to $30 by 2030.
$30. That's staggering. It's almost double the current federal minimum wage.
And way higher than any other major city.
You have to think about the impact on small businesses, especially outside of Manhattan. Critics argue that a raise that aggressive won't just increase costs. It'll accelerate automation and force thousands of low-wage jobs right out of the city,
Damaging the very tax base he needs to fund his other programs.
And where is that funding supposed to come from?
From the top, Mamdani promised hefty tax increases on corporations and individuals earning over $1 million a year. It's an explicit, unapologetic strategy of income redistribution.
Which confirms the exact fears of critics who were invoking Venezuela or Cuba. They see this as political punishment designed to drive capital out of the city.
Out of the financial heart of the globe.
And he's also looking to directly replace parts of the private sector with city government. I mean, that's the literal definition of socialism. He proposed establishing 5 city-owned grocery stores.
One in each borough, specifically to compete with private chains and drive down food prices.
And let's not forget the housing market. He proposed a citywide rent freeze on rent-stabilized units. If he does that, it won't just limit landlord income.
It fundamentally changes the entire calculation for developers and investors. You risk a severe constriction in new housing supply over the long term, which could make the crisis he's trying to solve even worse.
And we've already seen him jump on this. In his first few days, he set up task forces to remove bureaucratic and permitting barriers, but only for the affordable, government-friendly kind of housing.
And he immediately revived the mayor's office to protect tenants. The message couldn't be clearer.
The private sector is the adversary.
And the city's job is to constrain it.
Beyond the economics, though, his first day was just filled with political signaling. If we connect this to the bigger picture, his inauguration was pure political theater.
It was. The public event was officiated by Senator Bernie Sanders, the face of the modern American socialist movement.
And the private ceremony? The location was a decommissioned subway station. You have to admit, that is some seriously cinematic political messaging.
It's powerful symbolism. It's just the old system is broken, neglected, and that he's going to reclaim the foundation of the city for the people.
But the real controversy wasn't symbolism, it was policy. On January 1st, he revoked all executive orders signed by his predecessor, Eric Adams, after Adams's indictment.
A huge, provocative move meant to signal a clean break. But this blanket revocation caught global attention.
Because of Israel.
Because it included 2 specific orders related to Israel. One banned city agencies from boycotting Israel, a direct shot at the BDS movement, which Mamdani supports.
And the other?
The other defined certain criticisms of Israel as anti-Semitic, aligning the city with a controversial international definition.
And the backlash was immediate. The Israeli government condemned the move, calling Mamdani's decision anti-Semitic.
That is a serious charge for a new mayor of a global city on day one. It shows how his ideology immediately creates international tension. This is not just a local fight anymore.
So all of this ideological posturing, these immediate controversial moves, they've led us directly to today's crisis.
The massive nurse strike. This is the first major high-stakes test of his administration. It's his pro-union stance versus the reality of essential services and patient safety.
And the optics are crystal clear. Mayor Mamdani immediately joined the picket line, saying nurses deserve dignity, respect, and the fair pay that they deserve. He's explicitly championing the union's maximalist demands.
The NYSNA, the New York State Nurses Association.
But we have to look past the picket line rhetoric and at the financial reality, because this is where the whole exploited workers narrative gets, well, challenged by the data.
Sharply challenged. These unionized registered nurses are already among the highest paid in the country, and that's before you even factor in their benefits packages.
Wait, I have the numbers from the sources here. Are we really talking about registered nurses making 6 figures before any benefits?
Absolutely. The current average salary, so this is excluding health insurance, pension, all of that, is already $165,000 at Montefiore.
Wow.
And $162,000 at Mount Sinai. $163,000 at New York-Presbyterian. These are some of the most lucrative nursing salaries in the entire nation.
So the demands they're striking for are built on an already incredibly high-wage foundation. The numbers critics are citing are, frankly, staggering. Montefiore says the union is pressing for $3.6 billion in reckless demands.
And if those proposals were met, they would escalate these salaries to just extraordinary levels. Projections suggest the average RN salary could hit $220,000 at Montefiore.
Or even $275,000 at Mount Sinai within 3 years.
That is a massive wealth redistribution.
Yeah.
And critics argue it will be passed directly onto the city and state through higher insurance premiums, increased taxpayer burdens for Medicaid, Medicare, or just higher costs for everyone else.
Which goes right back to that democratic process argument. The costs are being forced onto the public because there's no market restraint. But the money is only half of this.
The other half is the most alarming detail reported by the hospitals, a detail that moves this from a financial dispute to a critical question of public safety.
What's the allegation?
It's the allegation Montefiore leveled against the NYSNA union leadership. Montefiore claims the union is demanding contract provisions that would protect nurses from being terminated if they are found under the influence of drugs or alcohol on duty.
You're kidding me.
No. The proposal suggests they'd be moved to rehab programs without losing their job.
Just think about the risk in that demand. Hospitals are saying this is putting self-interest before patient safety, that the union is trying to get around basic accountability.
Right. And while the union hasn't commented on that specific detail, the fact remains. A newly elected mayor is enthusiastically championing the demands of a union that is pressing for extreme fiscal asks and these highly controversial safety clauses.
So this raises an important question then. If Mamdani's radical platform, the tax hikes, the $3 wage, is designed to champion these maximal demands, how does that challenge the basic principles of balanced governance?
Especially in essential services like healthcare.
We established that legal theory suggests these public services lack the market constraints that limit private strikes. So when the city's highest elected official is actively encouraging these maximal demands that threaten safety and fiscal responsibility, what mechanism is even left to restrain them?
The danger isn't just the price tag. It's the precedent. If the concept of sovereignty is ignored, and if the mayor is willing to risk the city's financial stability and ignore safety concerns to prove an ideological point about union power,
Then the checks and balances that are supposed to protect the public good are just gone.
they're rendered meaningless.
Yeah.
And that is the fundamental question you have to grapple with as Mayor Mamdani executes his agenda. Whether his ideological commitment outweighs the practical constraints of governing a massive, complex financial capital.
So what does this all mean? We are witnessing the swift, unapologetic implementation of a hard-left agenda in the nation's financial heart. And it is testing the limits of traditional American governance on every front, from international policy all the way down to hospital beds. Thanks for diving in with us.